Proactive risk management with 3M Prevena therapy aims to help advance the standard of care by helping to reduce the risk of costly postoperative complications such as infection associated with surgery in patients at high risk. In this video, you'll learn a few tips and tricks to support safe and effective application of Prevena therapy on a closed incision after a spine procedure. Prior to use of Prevena therapy, consult detailed product indications, safety information, and instructions contained in the clinician guide. You'll notice that the hair has been preoperatively clipped to accommodate the area where the dressing will be applied. It is important that this area is clean and completely dry before application to ensure a tight seal. Once incision and peri-wound skin is clean and dry, apply 3M Cavalon No-Sting Barrier Film to peri-wound skin to prepare the area. To avoid tension or irritation on intact skin, use Prevena patch strips under the 3M Prevena dressing for protection. Avoid placing Prevena patch strips directly on the closed incision. When using 3M Prevena Peel-in-Place dressing, center the foam over the incision, taking care to avoid sharp bends or kinks in the tubing. 3M Prevena Plus customizable dressing can be cut to the size of your patient's incision. For long incisions, it may be helpful to enlist the help of a second clinician. Use the included extra hydrocolloid on the ends of the foam and wherever additional seal is necessary. No matter which 3M Prevena dressing you use, it's important to run your fingers around the edge of the dressing when applying and make sure to avoid stretching the material. Do not stretch the dressing or film during application, as tension can cause skin damage, such as tension blistering. With your Prevena dressing properly placed and sealed, you'll be ready to connect the dressing to a 3M negative pressure therapy unit, getting your patient ready for mobile recovery. If there's evidence of a leak, use Prevena patch strips around the dressing to ensure integrity of the seal. If you'd like to learn more about proactive risk management with Prevena therapy, visit Prevena.com. For patient troubleshooting resources, visit 3m.com/Prevena for patients.